I'm Laurie Sehn from BC Cancer in Vancouver, Canada, and I was here at ASCO presenting an oral abstract on a randomized phase 2 study of Polatuzumab Vedotin combined with Bendamistine and Rituximab versus BR alone in patients with relapsed refractory follicular lymphoma and diffuse large B-cell lymphoma. So in this trial, patients with relapsed refractory FL or DLBCL were eligible. For patients with DLBCL, in order to be eligible, they had to be considered transplant ineligible, so a relatively high-risk group of patients. And the study evaluated the addition of Polatuzumab, which is a drug conjugate targeting CD79B, which is universally present on patients with follicular lymphoma and DLBCL, combined with BR versus BR alone. So this study randomized 80 patients with follicular lymphoma and 80 patients with diffuse large B-cell lymphoma in a one-to-one fashion to either POLA plus BR versus BR. BR was given in standard doses for up to 6 cycles, and for patients receiving the POLA, they received a 1.8 milligram per kilogram dose intravenously with each cycle. The primary endpoint of the trial was PET-CR rate at the end of induction. So in terms of tolerance, the combination of Polatuzumab and Bendamistine or Rituximab was relatively well tolerated. There was an increase in adverse events that was seen in patients receiving the triple combination, but for the most part, the adverse events that were seen were low-grade in nature, and including peripheral neuropathy, which was largely reversible. In terms of the higher-grade toxicities, these primarily pertain to cytopenias. So there was a higher risk of grade 3 to 5 neutropenia and anemia seen in the Polatuzumab combination arm, and a slightly higher risk of febrile neutropenia. But despite this, there was no difference in the incidence of grade 3 to 5 infections between the cohort. In terms of efficacy, for patients with follicular lymphoma, the study primary endpoint of PET-CR at the end of induction was actually quite high in both treatment arms, and no difference was seen between the two arms. And at least with the follow-up that we have to date, which is still relatively short for patients with follicular lymphoma, there was no apparent difference in progression-free survival or overall survival. However, in patients with diffuse large B-cell lymphoma, there was a marked improvement in overall response rate, both at end of induction and for best overall response. In terms of the study endpoint of PET-CR rate at the end of induction, this was markedly improved in patients receiving the Polatuzumab and BR. So that was 40% with the triple combination versus only 15% in patients receiving BR alone. This improvement in response rate did translate into a significant benefit in terms of progression-free survival. The median progression-free survival was more than 6 months in the patients receiving the Polatuzumab versus only 2 months in patients receiving BR alone, and the hazard ratio is 0.31. And importantly, it also translated into improvement in overall survival. So patients receiving the Polatuzumab had a significantly improved overall survival with a median OS at over 11 months compared to under 5 months in patients receiving the BR for a hazard ratio of 0.35. So to summarize, the combination of Polatuzumab and BR in this patient population appeared to be relatively safe, but importantly, at least for patients with diffuse large B-cell lymphoma, led to a marked improvement in response rates, progression-free survival, and overall survival. And based on this encouraging data, this drug has actually received a breakthrough therapy designation from the FDA, as well as a PRIME designation from EMA, and so will be evaluated in additional combinations, and also is going to be tested in the upfront setting in diffuse large B-cell lymphoma.